नमस्कार. मी डॉक्टर अतुल अग्रवाल, फिजिशियन, नाशिक रोड, practicing at Ashword Care Plus Hospital. On this World Hepatitis Day, which is on 28th of July, with the theme of "We can't wait for a world without hepatitis. Together, we can make it happen." As rightly said, this hepatitis is quite common problem, which is undetected till the time symptoms are quite obvious. During routine testing, we do diagnose lot many patients, but those symptomatic patients only come to us for consultation and treatment. But those roaming around are not aware what is hepatitis, what it should be. So this is a small effort by Microlab to come to you people and communicate with you as being a doctor. So on this World Hepatitis Day, few facts are there regarding hepatitis. What has to be done, what not to be done, what is hepatitis. As WHO data is recently published that almost 45 lakh people, that means 4.5 million people in worldwide can be prevented with a premature death just because we take care of our day-to-day life and vaccination. Mainly hepatitis B and C. These are the two diseases which are preventable by vaccination, and we can save almost 45 lakh life by 2030 if we vaccinate and we do communicate with the people about hepatitis. The number is quite good, which is I feel as a responsible physician to communicate, to inform you that yes, we can share some part, we can save the life, because we save the one life, we almost definitely save one family, which is important for the family. So coming to the part of this discussion, hepatitis symptoms are very simple as we know: fatigue, lethargy, reduced appetite, yellowish discoloration of urine and eyes, generalized fatigue, and along with some joint pain in few of the cases. Sometimes the stool is clay color. But diarrhea, which can be there in few cases like hepatitis A or viral diarrhea during our monsoon season. Hepatitis A also is one notorious disease which can be treated and damage can be prevented. Specifically, hepatitis B and C. These are almost similar. These are transmitted through needle stick injuries, open wound exposure with the contaminated blood, along with sharing of needles, particularly those who are drug abusers. In those kind of cases, or sexual transmission, where hepatitis B and C is transmitted and can be affected to the partner, those who are in the relationship, which is preventable disease. Then comes hepatitis D. Those who are exposed to hepatitis B can be having hepatitis D with a similar presentation, but they should be having hepatitis B first. So just by giving the vaccination hepatitis B, we can prevent hepatitis D also, and hepatitis C also is preventable in the same way. Coming to the remaining two viruses, A, B, C, D, E. So B, C and D we have covered. Hepatitis A and E are almost similar. It's a fecal route. That means contaminated hands, food, ill-cooked food or contaminated food can transmit this infection, can present as a diarrhea. A can be difficult to manage, but yes, can be covered. Hepatitis E is quite notorious. If detected during pregnancy, can take to the patient's life also. Patient can have a death in the hepatitis E. It's a fulminant hepatitis, what we call. So friends, how we can prevent it, what has to be done, what not to be done. So first we will discuss what not to be done. If we are aware that my partner is a carrier or someone is a carrier with hepatitis B, C or D, we have to avoid their sharp objects like shaving blades. We have to cover the injuries with the band-aid or dressing, because covered surface or exposed surface is a very raw material where infection can be transmitted. Even a single drop of blood on injured wound can transmit the infection. Those who are having habit of alcohol and if they have found to have hepatitis B or C, cut down the alcohol or stop it, which can prevent the further damage, because combination of alcohol with infected hepatitis B or C can be fatal for the future. It will not happen in one day. It will take years together to develop the liver cirrhosis or sometimes even cancer in the few patients. For A and E, we have to always use boiled water, cool it down, and then use it during monsoon season to prevent the infection from hepatitis A and E. We have to maintain our hygiene, sanitation properly where we are living, because infection can spread from those places also. Coming to the what has to be done then. We know very well these are the few facts which we got it done. Suppose someone is having the hepatitis B or C as a carrier in their blood report during routine examination. We request partner to get testing done. If the partner is negative, in that case, we do go for the vaccination before having the sexual relationship with the partner. So that is also one of the important factor to do in the first part. Then when patient gets affected with hepatitis B and C, that part will come later. But what are the common things we have to do? Avoid alcohol, take a healthy diet, drink proper amount of water, avoid tobacco and tobacco products.